Welcome to ThinkTech on OC16, Hawaii's weekly newscast on things that matter to tech and to Hawaii. I'm your host, Duke Oishi.
And I'm your co-host, Nicole Hori.
In our show this time, we'll visit the 9th Annual Community Health Fair at the John A. Burns School of Medicine in Kaka'ako.
We met the students and faculty who organized and presented the fair, and some of the visitors and exhibitors who came to participate.
My name is Nash Witten. I'm a first-year medical student and the MS1 co-chair of this event today. It is the annual celebration of health and well-being, with this year's theme being Iola no Ke Kino, or May Your Body Thrive. We are at the Kaka'ako campus of the John A. Burns School of Medicine and the UH Cancer Center. So today we have over 50 vendors. We have activities including Tai Chi, Qigong, Yoga, Zumba, mindfulness demonstration. We have a talk by Dr. Terry Shintani. We have two filmings of Ola. We have diabetes education. And we have food trucks, we have the cafes open, we have all kinds of things going on. Also, there's going to be Zumba, if you're into that, in the Wellness Center at the Cancer Center. Well, as a first and second year medical students, we have to take community health elective courses. And so we're already doing things in the community, but the community isn't really broad aware of the things we do. So we're doing the event today so that the community can see what we do, and also to invite our community partners in to just help make it a day of health and well-being at the medical school.
I'm Kim. I'm the Early Intervention Coordinator at the National Kidney Foundation of Hawaii. I'm here to promote awareness and prevention of kidney disease.
Books are in the back there, and we have a lot of.
I'm Charlie Eggisdahl. I'm here with Healthy Keiki Can. We kind of are trying to spread the healthy message to the children of Hawaii, and we have a little thing where kids can fish for healthy snacks here, and we're showing the different sugar contents in a lot of the sugary drinks that kids tend to drink. And with this program, we go out to Nanakuli High School once a month. We work with the children out there, and also work with pediatricians in the community to shadow them and learn more about taking care of children and keeping kids healthy.
Hi, my name is Sean Jan Catarino, and I'm also working in Healthy Keiki Can with Charlie. I guess something to add is it's part of the Native Hawaiian Center of Excellence.
Because I'm actually with Cool Ola. We're like the sister community health group with Healthy Keiki Can. So we work with the intermediate students at Nanakuli, and we work with like 8th graders. And so we try and do the same thing. We actually did the sugary drinks thing presentation with them and kind of wanted them to see what was in their drinks. And we spend once a month we go on fun field trips with them, and then we also do presentations to kind of like help them prepare for high school.
This is now the 9th annual event with our medical students, organizing and bringing in community membership and community organizations that are focused on the health of the community, as well as programs that our students are actively involved in themselves. This is the first year, however, that we're connecting with the Cancer Center because of the Cancer Center just recently opening, and now we're doing health and wellness in conjunction with the Cancer Center. And so we have presentations based out of the Cancer Center over in the Sullivan Conference Center, as well as here in the Jabsom both foyer and the library where you're at right now. Our students, both on an elective basis but also as part of their scheduled curriculum, are expected to be a part of the community in terms of participation in health programs. So most are involved very heavily in at least one, if not multiple programs. So this is the opportunity for them to kind of tell a little bit about what they've been doing, to connect up with some of the members of the community that have goals and objectives, and then to see what they can do next year to bring the information to the public. And part of their education is learning how do you both organize such an event and how do you kind of bring the community in, how do you promote it, how do you get the community involved and engaged. Now our students have been doing it for the 9 years, but each year they build upon the success of the prior years. Now keep in mind that it's our first year medical students who are doing the bulk of the work, but they have advisors from the second year who did it the year before. Plus, Tina Shelton, our media and communications expert, helps them a bit with getting the word out and making sure that people understand what the whole event's about. We have been a community-focused medical school almost from the beginning, and just like the Chancellor's intent to reach out and make sure we're connected and relevant to the community, that's really job one for our medical school. we're not only training the next generation of providers for Hawaii, but we're trying to make sure that we're actively engaged in the health delivery in the community and a wellness message. You know, our vision for the school is to attain optimal lasting health for all, or aloha. So that's our goal. And we're really trying to make sure our students are focused on health, not on disease. And I think they're doing a great job with that.
Hi, I'm Crystal Lam, and we're the Women's Interest Group at Jabsom. So we're medical students, and we promote women's health and women's issues. We participate in the Susan G. Komen race for breast cancer. We hold movie nights about women issues. We have a Mother's Day project. We collect toiletries and make gift bags for homeless children to give to their mothers. The 5 healthcare problems that affect women or the top 5 are heart diseases, breast cancer, dementia, depression, and osteoporosis. So just knowing things like that, it helps us with our medical education.
Just giving back to the community, as future physicians, we're here to help take care of patients. So this is just kind of a first step that we know we're just giving our time to help talk to people. And
Hi, I'm January May Andaya, and I'm a second-year medical student at Jabsom. I'm here to help with the Women's Interest Group. I'm actually one of the co-presidents with Crystal Lam that you spoke with earlier. It's a very good school. It's as you probably know, it's a problem-based learning school. So it's all about independent learning and being able to teach your classmates in a succinct way, but also to apply the clinical aspects of it. Yeah.
One other thing I wanted to ask you. I'm having a little pain right over there. What do you think I should do about it?
I would say see a Jabsom doc.
There is in the cancer building a little station where you can, quotes, see your DNA, unquotes, yeah. There's several stations where you can find out information about the Affordable Care Act. There's some tables, 3 of them, that talk about or give information about Medicare fraud, how to identify it, and little booklets for seniors to write down their visits and compare it with the billing that they get and all that. There's a number of health information also, including the little demonstration in the middle. So I think that's great because we all need to know about that. In particular, in the cancer side, there's some statistics about what kind of things lead to cancer. Good information, particularly since it has to do with diet, which many of us don't know enough about as far as how much diet impacts our health.
My name is Caleb John, and I'm a first-year medical student here at Jabsom. And today I am representing Global Health and Rural Health Interest Group. I'm basically representing Jabsom's Global Health and Rural Health Interest Group. We are focused on raising awareness in the community regarding some of the more global health concerns as well as in the more rural areas.
Hi, I'm Joe Schwartz-Martin. I'm a third-year medical student at University of Hawaii at the John A. Burns School of Medicine. So here we're providing preventative medicine for the community, for anyone who wants to come down for our community health fair. So we're providing blood pressure screening, glucose checks, and also flu shots. So this all kind of falls under the realm of preventative care. So we help people to find problems with their health before they start. So screening for things like hypertension, high blood pressure, for diabetes. So it's a good first way for people to check if they might have a problem that they might want to seek further medical care for.
My name is David Niumatololo.
And what are you doing here?
I'm a first-year medical student. I'm representing Sunny Buddies, which is an organization that helps provide meaningful relationships to the intellectually challenged. So basically we go on different outings throughout the month. It's pretty flexible, things like movies or any activities that our buddies have interest with, and we basically build relationships with them to help develop different communication skills, social skills, and things like that, and also pretty much to have fun with them. I've been married for 1 week, so I just got off the boat, fresh off the boat about 3 hours ago, and so far it's mean.
Still one, and it makes me strong. Still one, I wanna take it along. We're still having fun.
In my lab, we study how inflammation like colitis to cause colitis-associated colon cancer. We use animal models to study that one. Another very important thing is about cancer prevention. So we know that cancer is very hard to cure. And for example, breast cancer survival rate now about 87%, and higher for women, about more than 30% of them are going to recover. So relapse, so recurrency rate is very high. So if we are able to prevent cancer, we don't need to find a cure, right? Nobody has cancer. So now it's hard to get it, but one thing we should know that it's about aspirin. Aspirin is very generic, and it has been shown that aspirin is able to reduce incidence of colon cancer and breast cancer up to 25 to 30%.
We're just out to promote our services of what we do for diagnostic labs. Had a good amount of people come by, say they use us, and we're just reminding them where we're located at. And yeah, we're just trying to do our part.
Well, we are Shriners Hospitals for Children, and we're so excited to be a part of the Jabsom and UH Cancer Center Fair to just spread awareness about what we do at the hospital. The biggest challenge for Shriners is just to get the word out that we are orthopedic pediatric specialists, so that's bone, joint, and muscle therapies, and that you don't have to be a Shriner, you don't have to be a certain income level, you can be from Hawaii or from the Pacific Islands. And so being a part of this event is just a really wonderful way to expose people what we do and to kind of interact as well. We have a brand new facility, it's gorgeous, it's on Punahou Street, there's a huge aquarium in the middle. The kids love it. We have a brand new fracture clinic, so if a child falls down and breaks a bone or has a sports injury, they go to ER and then they can walk right into Shriners Hospitals the very next day, no appointment necessary, to see one of our orthopedic surgeons. And we also have a new pediatric neurologist who is dealing with kids with autism and brain injury, ADHD, and this is a really big service for the community.
More. We're just classmates, and we asked who wanted to dance for the health fair, and there's a couple of upcoming events that we're going to be dancing at as well. So we just got together and started dancing, and we had a great time doing it.
My name is Joseph Ruth, and my daughter goes to the Burns School of Medicine.
So my name is Ruel Reyes. I'm a first-year medical student here at Jabsom.
How do you like it?
It's pretty good. I really enjoy the atmosphere. My classmates are awesome, very family-like. So.
How come you weren't in the hula group?
Oh well, I don't have as good moves as my fellow classmates, so. So today we have several different types of booths. We're trying to reach different, I guess, demographic groups, from like very young people to, I guess, more of the elderly population. So we have groups from like the National Kidney Foundation, the blood banks here, so people are donating blood, such an awesome gift to others. We also have different student groups, because we all have different community health groups that we are a part of. We have like blood pressure screening, blood glucose checks, flu shots, because we're joined with the UH Cancer Center along with the med school that we're a part of. We have some public groups like Shriners, DLS, Diagnostic Laboratory Services, Planned Parenthood is here, and yeah, we try to try to reach a wide variety.
So we were invited here to attend by the Cancer and Medical School Center because we've done partnership with them in the past. A great opportunity for us to actually come out and tell the community what exactly is that we do and just be there within the community because we are a community, we're an organization for the community. So Planned Parenthood was very active during the special session like SB1 bill. We had our CEO give a couple of speeches. She went up against in front of the Senate and other committees and basically said that individuals deserve the right to choose the lives that they feel that it's appropriate to them.
My name is Rasham Ramkisoon. The class of 2017 at the John A. Burns School of Medicine. It's the first year class. Medical school is wonderful. Our class is actually still in the honeymoon phase. We're still actually happy to be where we are and just enjoying the medical school life. There is a lot of work, but we're also trying to enjoy ourselves at the same time. There are 67 students in our class. It's a relatively small medical school compared to other schools in the mainland. Today we're hosting the annual health fair. And so we're all here today just to tell the community about what we're here to do for the community. Our school is about traditionally about helping the community and getting a lot of people involved with serving rural communities and also serving the homeless population. So we're here to show people exactly how devoted we are to that. There are a lot of other demonstrations like yoga and Tai Chi, but we're also committed to staying true to the Hawaiian tradition. As you saw outside earlier, we had a traditional hula dance, which was really nice. Today we have a lot of class members. The first year class is here, the second year class is here. We had Miss Hawaii, her name is Crystal. She was here earlier today. Parked out front, we had the blood bank of Hawaii. That was, if you want to donate blood, you can actually do that. We had a lot of other vendors in the community that just want to help out. Traditionally, it's the first year class that hosts it, right? That does most of the fundraising, but the second, third, and fourth year class are here to support, of course. Jabsom's a wonderful school. I'm really glad that I came here. I actually came all the way from Canada.
Okay, thanks.
What we are doing today here, it's just kind of making science fun. So we are extracting DNA from people's cheek cells inside the mouth. And basically all you have to do is you just put a little bit water in your mouth, you chew up your cheek so that you release cheek cells. And then we just put some simple lysis powder, it's like a detergent. We put some protease enzyme, and then people have to incubate. They become walk-in, living incubators. They have to hold the tube in their hands for at least 5 minutes.
The medical students at Jabsom originally organized the fair in 2004 to interact with the community they intended to serve as physicians. Since then, the fair has regularly provided information about the health resources in our community.
This marks the first time that Jabsom and the new Cancer Center in Kaka'ako have co-sponsored the fair. It was great to see the brand new Cancer Center building on the Jabsom campus.
The medical students at Jabsom originally organized the fair in 2004 to interact with the community in which they'll soon serve as physicians. Since then, the fair has regularly provided information about the health resources in our community.
The theme for the fair was Iola no Keikino, or May Your Body Thrive. The fair is customarily organized by medical students and draws hundreds of visitors to the medical school.
First, the medical students hosted an opening ceremony. Then a variety of activities continued throughout the 4-hour event.
There were a variety of activities and performances, including Zumba and Tai Chi demonstrations, a hula performance by Jabsom students, and music by Simply Said.
First, the medical students hosted an opening ceremony. Then, a variety of activities continued throughout the 4-hour event. The place was teeming with visitors.
There were also lectures. Dr. Terry Shintani, author of the Hawaii Diet, spoke about how to lose weight and reduce the need for medications.
Nearly 50 groups participated, from state experts in insurance assistance and health careers to a variety of vendors, including food trucks and farmers.
Visitors could sign up for the Hawaii Bone Marrow Donor Registry or donate blood in the Blood Bank of Hawaii Bloodmobile. There was something for everyone.
Those looking for free healthcare screenings were in luck. Retinal and eye exams, blood pressure and glucose checks were offered. The fair was full of exhibitor tables featuring health and wellness information.
It was great to visit the medical school and the new Cancer Center and see what is happening there. And a big thanks to our own intrepid medical student tour guide, Kate Ristad. For more about the fair, see the UH Health Wellbeing page at facebook.com/UH Health Wellbeing.
The sponsors of the fair were the Blood Bank of Hawaii, Islands Hospice, Aloha Care, and Kaiser Permanente. Thanks to them for supporting this great event, and good for the medical school and the students for putting it on. And now, let's take a look at our ThinkTech calendar of events going forward.
ThinkTech streams video and audio of all of our shows live on the internet from 1 to 5 p.m. every weekday afternoon, and we replay them all night long on Ustream.tv. Visit thinktechhawaii.com for our live stream and YouTube links. Raise your awareness on ThinkTech.
And now, here's our ThinkTech news.
I'm Nicole Hori for ThinkTech News. In local tech news this week, there's been a big announcement that there may now be a replacement on the horizon for the Manoa Innovation Center, the symbolic center of Hawaii's tech startups. The university, right or wrong, is taking back Manoa Innovation Center and will be using it for office space. MIC has been the home of the state's High-Tech Development Corporation, as well as a great many tech startups in Hawaii. For the lack of legislative action to renew the lease, which created MIC in the first place, there would have been no place for HTDC and its tech startup tenants to go after the university takes MIC back in 2015. This would have been a disaster for the center, for HTDC, and for tech startups in Hawaii. But now, at what amounts to the last minute, a new plan has emerged by which MIC will have a new home in Kaka'ako. And that's appropriate, because as it has worked out, Kaka'ako is becoming the go-to place for innovation and startup millennial entrepreneurs in Hawaii. This development will go a long way to confirm that direction for Kaka'ako. HTDC is working on a plan to develop a new $22 million headquarters and is handing off planning and design work to the Hawaii Community Development Agency, another state agency that has agreed to provide land in Kaka'ako. HCDA will take the planning role for the new project and include the new HTDC building as part of a technology and innovation complex to be built on a 6-acre site just ever of the university's John A. Burns School of Medicine. HCDA owns the parcel, currently called Parking Lot 3, and had previously committed to lease it to the university for the Cancer Center. But in recent years, the Cancer Center was developed instead on a parcel makai of the medical school. A new master plan for Parking Lot 3 calls for a common parking structure with 900 stalls, 150,000 feet of additional office space for the university, and 50,000 square feet for HTDC's headquarters building. In 2012, the legislature had appropriated $3 million to HTDC to plan for and design a new facility. HTDC spent $275,000 of that finding a suitable site and has now agreed to move to the HCDA property in Kaka'ako. Last week, HCDA's board agreed to accept the balance of the appropriated money to continue this planning and design work. HTDC plans to ask the legislature for a further $22 million to build the new building. At this point, the tech industry needs to support that request, and the legislature needs to approve it. I'm Nicole Hori for ThinkTech News.
We'll be right back to wrap up this week's edition of ThinkTech. But first, we want to thank our underwriters.
Hawaiian Electric Company and its affiliates Maui Electric and Hawaii Electric Light Company on Hawaii Island are deeply committed to the communities they serve.
Galen Ho is a senior executive of BAE Systems, a global defense, security, and aerospace company.
The High-Tech Development Corporation, the state's leading technology agency, attached to the Department of Business, Economic Development, and Tourism.
Castle & Cook Hawaii, with a time-honored legacy that spans more than 160 years and revolves around its mission of investing in Hawaii, creating communities, and providing for the needs of our state.
Hawaii Gas, formerly the Gas Company, a proponent of the Liquefied Natural Gas Initiative, helping Hawaii achieve its transition to clean energy and a better energy future.
Collateral Analytics, a Hawaii-based tech company empowering the real estate industry with greater and faster access to the tools and data they need to make better informed property investment decisions.
The Foreign Trade Zone, operated by the Department of Business, Economic Development, and Tourism, encourages international trading in Hawaii and brings the benefits of the Foreign Trade Zone program to Hawaii businesses and entrepreneurs.
Okay, Nicole, that wraps up this week's edition of ThinkTech. Remember, you can watch ThinkTech on OC16 several times every week. Can't get enough of it, just like JFI Dell does. For additional times, check out OC16.tv.
Totally, Duke. For lots more ThinkTech videos and for underwriting and sponsorship opportunities on ThinkTech on OC16, visit thinktechhawaii.com. Be an underwriter, a sponsor, or a volunteer, and help us reach Hawaii.
I'm Duke Oishi. Thanks so much for joining us on ThinkTech. You can watch this show throughout the week and tune in next Sunday evening for our next important weekly episode. Aloha, everyone.
I'm Nicole Hori. See you next time.